Bernie Sanders and some of his colleagues introduced a Medicare for all bill a number of years ago. And that particular bill would have been an absolute disaster. For a whole host of reasons. Like, for example, it just doubled down on fee for service and gave coverage of almost 100%. It didn't do anything to address the digital infrastructure, the incentives, pharmacy bills, like the things that I'm talking about here that would.
Yeah.
So you would have had just complete runaway inflation that couldn't possibly be afforded by the country and wasn't holding anyone accountable for the quality of the care or the service that they were providing.
Right.
Now, that's not to say that someone couldn't come up with a Medicare for all proposal that is actually affordable, that actually could potentially improve the system. So I believe the things that I and we believe in, we're putting out there with Worthy. And I happen to agree with Atul Gawande, who wrote about on this a number of years ago, which is to say that I feel like healthcare is so fundamental to everybody that you want to be messing with it as little as possible. So whatever system you happen to be on, you want to make only the changes that are necessary to make in order to sort of optimize the performance of that system. Because if you try to turn the United States into, say, the United Kingdom, it's such a massive transformation that all kinds of things would go wrong. But then again, the same thing, if you were in the United Kingdom and you wanted to turn it into the United States, that's a bad idea. And you're messing with people's health and their lives. And so someone could come up with some kind of Medicare for all proposal that could make sense and potentially could get support from the private sector. Because if you think about Medicare for all right now, more than half the beneficiaries are getting their Medicare through a private health plan. And so, you could interpret Medicare for all to be all kinds of things.
Right.
There could be someone who comes forward with a proposal that makes a lot of sense but it could be described under that rubric.
Yeah.
The things that I have seen so far in the Medicare for all don't address the fundamental issues with the healthcare system. They don't change the payment methods. They don't hold the healthcare providers and others accountable for the quality of their service and their care.
Yeah.
It doesn't address pharmaceutical pricing and how to make it affordable and manageable. And so anyone who comes up with a solution, whether it's Medicare for all or something else, need to put forward something that addresses those fundamental drivers, or it's just not going to work. And I would say the one comprehensive bill that has been put out there for Medicare for all that I have seen was Bernie Sanders' bill from a number of years ago, and it did not meet that test. That's not to say, again, Vincent, that somebody couldn't come up with something that's actually worthy of our attention and debate.